Hello, Dr. Andy Rosenbarb here. Today I'm going to talk to you about alternating current stimulation and how it can help macular degeneration and other types of macular issues. Other macular degeneration, we'll talk about dry macular degeneration, wet macular degeneration, other conditions like Stargardt's macular dystrophy, things like CSR, central serous retinopathy, also conditions like pattern dystrophy and myopic degeneration. All these conditions can really affect the macula, which are specifically the cone cells. So today I'm going to talk to you specifically how alternating current stimulation can help recover some lost vision and also help prevent vision loss if you're dealing with macular issues. So let's talk first about macular degeneration. Of course, you know there are two types, right? There's the dry type macular degeneration and there's wet type macular degeneration. Now, dry type macular degeneration is the presence of drusen, which is the cholesterol that builds up in the back of the eye, that distorts and clogs the blood vessels and affects our reading primarily, our acuity, our central vision. So what happens when people have macular degeneration is first things get wavy or distorted. That's usually the first symptom. If it progresses, then ultimately the central vision can really get very distorted, ultimately where you can't even see the central vision. All you can see is what's around you. So it's very, very difficult for people with macular degeneration as it advances to be able to read, to recognize faces, to drive. These are important things, right? So what happens with wet macular degeneration is there's so much congestion and such impaired blood flow rather to the retina and specifically the macula that the body has to grow new blood vessels in a process called neovascularization or angiogenesis. Those are fancy words for saying new blood vessel growth. Now, the original pipes or blood vessels, if you will, are pretty strong and sturdy. Over time, they'll age and start to break down. The new blood vessels that are created to deliver because the main blood vessels are either clogged or broken and not working, the body's growing these new blood vessels, those are usually very weak and susceptible to rupturing. So what happens is somebody will have these new blood vessels grow and they'll either get a headache or get a flu or maybe a head trauma, or their blood pressure can go up, or drinking too much alcohol, they get really upset. Maybe the allergy attack or something like that, and you'll get a bleed, right? These blood vessels will pop and start to hemorrhage, and you have wet macular degeneration at this point, to where you'll probably have to get injections to help absorb the blood, sometimes laser therapy as well. So the injections, all they do is help absorb the blood. They will not do anything to help improve your reading. They're not really going to address the macular degeneration part. They're just designed, these anti-VEGF drugs like Eylea, Avastin, Lucentis, all these injections to help clean up the bleeding, right? That's really what they're designed for. So if that's handled, that's fine, but we still have to deal with the macula. We have to deal with the health and function of the macula. So if we look at some of these other diseases like pattern dystrophy or myopic degeneration, or where you have fluid or edema that accumulates in the macula called CSR, central serous retinopathy, these are other conditions of the macula. You could even have macular puckers and macular holes, right? These are other conditions that can be a degenerative macular process. So we also, again, have things like Stargardt's macular dystrophy, which is part of the retinitis pigmentosa family, which my experience has been these are autoimmune conditions that often can start early in childhood where the immune system is attacking the cone cells, right, the macular cells, and causing a progressive degeneration and breakdown of that function. So it's often called juvenile macular degeneration or early onset macular degeneration. And that could start anywhere from 3 to 4 years old to teenagers to 20s. I've had patients start in the 40s 40s or 50s with that. So Stargardt's can be early or later onset. So all these conditions, right? There's not too much available in terms of treatment. We know wet macular degeneration. You can get shots, injections of these anti-VEGF medications that'll stop the bleeding, but it's still not addressing the underlying macular degeneration issue. And then again, if you're talking like cone dystrophy, if you're talking about Stargardt's, if you're talking about myopic degeneration, if you're talking about macular holes or macular puckers, for macular holes, there are surgeries where they try to, squish the two parts of the retina together. 9 out of 10 or 8 out of 10, I would say, probably are unsuccessful. They work sometimes. I've had a lot of patients who've had these done, and I've had one patient in 25 years told me that it actually improved her vision. It worked out really well. So it's not really a great therapy. There's no drugs, there's no medications, there's no surgeries, there's no conventional biomedical integrative therapies or treatments for these conditions. So right now, people need help. You need help. Maybe it's you, maybe it's a family member, maybe it's a loved one, maybe it's a friend, a colleague, somebody dealing with this. So one of the things, the solutions or treatment modalities that we're offering is something called alternating current stimulation. Now, why would I come up with alternating current stimulation? We're going to talk in a minute about what specifically ACS is, ACS alternating current stimulation, and how it works. But first, I want to talk about why did I create this? Like, what was the motivation or the inspiration behind developing this home ACS 3000 unit? I'm glad you asked. So the older units, so you may be aware, there are older microcurrent stimulation units, okay? These units were about 30, 35 years old, and they were okay. I use them with a lot of patients. Again, I've been doing this for over 25 years, so I've had a lot of patients. I even recommended microcurrent stimulation for a while. In my clinical experience, I would say approximately 50% of patients reported some improvement with alternating current stimulation. That's a guesstimate based on just conversations and feedback from patients. For me, it wasn't enough to really recommend it, because for me to make a recommendation, I like to see a 70% efficacy, right? I want to see 7 out of 10 patients who are going to show some measurable improvement. So there's also a need for accessible and affordable treatment, especially with COVID and the lockdowns and the travel restrictions that were going on. A lot of my patients were stuck. They were stuck in different states. They were stuck overseas, and they lost their jobs, and there was a financial hit to a lot of people. So affordability became an issue, and also traveling to our clinic. A lot of patients couldn't get to our clinic because there were travel restrictions, right? We couldn't get, and we don't know, maybe that's going to happen again. So that's prompted me and inspired me to create something that you guys can actually use at home that was safe and effective, and that was going to get very good results, at least 7 out of 10. That was the goal I was shooting for. So the home therapy can be used as a standalone therapy. You can use it by itself with supplements and diets, or it can be used as an integrative therapy with other modalities, such as acupuncture, electroacupuncture, laser therapy that we use in our clinic, hyperbaric, eye exercises, vision therapy, eye qigong, eye yoga, any of these other therapies, integrative holistic therapies that may be used to help benefit your vision. So another reason why I created this initially was because I had been treating a lot of pediatric cases. We have an AccuVision Junior program where we treat young children, sometimes 3, 4, 5 years old, who, as you might imagine, are not necessarily tolerant to needles, right? So that becomes a deal breaker, because we don't want to make it a negative experience for kids, and we certainly don't want kids like crying and being upset, and because they got needles. So I was always looking for new ways to help children, and alternating current stimulation was a really, really good way that we found that was a way to help children. And after we found the benefits for kids, I started using it on teens and adults, and we found even more success. So that's kind of where that came from. Again, safe and effective. There's a lot of research behind alternating current stimulation. Now, at the time I'm recording this, it's November of 2022. The ACS units have been out on the market since around May of 2022. So about 6 months or so. We're getting really, really good feedback from people. But the initial, so we don't have to date an enormous amount of quantifiable research because we haven't really pooled all that. But that said, in terms of alternating current stimulation therapy, there is a tremendous amount of research behind that. So if you go to Google or you go to Google Scholar or you go to PubMed and you type in macular degeneration or retinal issues, eye diseases, alternating current stimulation, what's going to come up and what you're going to find is research mostly from Europe, specifically from Germany. In Germany, they've been doing a lot of research over the last decade on alternating current stimulation for initially optic nerve issues, and then they advanced it to retinal issues. So the research that's out there, there's research on alternating current stimulation, alternate transcorneal stimulation. We're going to talk more about that, the research side, in a minute. And of course, it is safe and effective, and which is obviously why we tested it in clinic to make sure there's no side effects. I'll talk more about that in a few minutes as well. So, what is alternating current stimulation? Alternating current stimulation is an electrotherapy where we use electric frequency specific alternating microcurrent stimulations to help recover and preserve vision long term. Now, these tiny electrical microcurrents are barely perceivable, and they provide an electrostimulation to the eye and brain's visual system. They also stimulate the acupuncture points around the eyes, which we know to be very, very effective for helping with repair and regeneration of vision. We know it's safe, we know it's effective for most neuro-ophthalmic conditions, neurovascular ophthalmic conditions, which is what macular degeneration is. It is definitely a neurovascular disease. Neuro meaning affects the nerves, specifically the cone cells of the macula and the fovea. And we know it's a vascular issue because we have buildup of things like cholesterol, or we call drusen, which is primarily fat and some calcium in there and some protein. So that's a metabolic waste that's built up. When we use alternating current stimulation, we'll talk more about the mechanism, but we're stimulating the facilitation of the detox of this buildup of drusen, all right? And there's other factors I'm going to talk about in a minute when I get to how it actually works. So when you look, if you do some research and you're online and you're looking at Google Scholar or PubMed, you may come up with terms like transocular stimulation or transorbital stimulation, which are also alternating current stimulation. It's just different terms that are used. So I've had people come up to me or reach out to me and say, hey, I didn't see anything on alternating current stimulation, or I didn't see much on ACS, but I found all this information on transocular, transorbital stimulation. What's that? It's the same. It's just different terms that they use for the same types of treatment. So wanted to let you guys know about that. So how does the ACS work? Alternating current stimulation, how does it work on the visual system? So the ACS electrodes use specific frequencies to stimulate the visual system, the retina, the optic nerve, and the brain. What's happening here, the mechanism of action, is really twofold. There's two things we're really trying to do. Wake up the dormant cells, the macular cells, and we're trying to dilate the blood vessels to increase blood flow to the macula. When we dilate the blood vessels, we bring more oxygen, glucose, and nutrients to the eyes and brain, which allows the nerves to eat, breathe, metabolize, regenerate, and detoxify. Okay, so we're waking up these dormant cells, right? Some of them are sleeping, right? When we do a visual field test, we can see that there's some black areas and loss of function, right? If the nerve cells aren't picking up light, which is what their functions are, photoreceptor, photolight receptor to receive light, what happens is they go to sleep and they're not doing their job of picking up these light impulse or these photon impulses. So the alternating current stimulation, in addition to dilating the blood vessels to increase blood flow to the eye, remember the retina and the macula is the highest oxygen consuming tissue in the whole body. So we want as much oxygen delivery to the eye as possible. And when oxygen delivery is impaired due to drusen, vascular vasoconstriction or congestion of the blood vessels or breakdown of the vascular in the retina, which is called the choroid, we have problems because we're not getting, again, the oxygen, the glucose, and nutrients needed for optimal visual function and cellular function. So these again, these dormant cells start to wake up. The damaged and sick cells will also start to repair and regenerate. Another function that's happening is we're activating what's called neuroplasticity. What neuroplasticity is, it improves the brain's remaining visual capacity by rewiring and refiring the neurotracts, right? The visual nerve pathways that go from the retina to the optic nerve to the brain. So we want to have what's called neurocoherence, which is a clean signal, right? An optimal clean signal where these light signals get sent to the retina, transform to chemical potentials, and then send via nerve impulses from the retina to the optic nerve to the brain for processing to see what we see. We also know that alternating current stimulation can guide stem cells and growth factors to the eyes for repair and regeneration. We know there's a lot of talk about gene therapy and stem cell therapy. It's my opinion that with these eye conditions like macular degeneration, Stargardt's, cone dystrophy, macular holes, macular puckers, myopic degeneration, and pattern dystrophy, that there's not necessarily an insufficiency of stem cells. Rather, they just can't get to the area, right, because of lack of blood flow. And the environment is not hospitable. So these stem cells, even if they get to the eye, they can't germinate and grow and develop into mature retinal cells or macular cells. So what we're trying to do here is we're trying to dilate the blood vessels so that when we do have stem cell release from the blood, from the bone marrow and from the fat cells to the eye, that we actually have delivery right to the macula. We clean up the environment through supplements, diet, ACS stimulation, even other things like acupuncture and hyperbaric, for sure, to improve the environment and dilate the blood vessels so we have a healthier environment for which stem cells can actually grow and repair and recover. So if you do stem cell therapy and the blood vessels are clogged, the stem cells are not going to get to the eye, even if you inject it around the eye. So that's why things like acupuncture and alternating current therapy and stimulation can be super useful, even as an adjunctive if you're getting stem cell therapy. We have quite a few patients now who have opted to get stem cell therapy, and they're getting it, and they're using alternating current stimulation to guide the stem cells to their eyes. It started in China when they were using acupuncture for that. They were doing injections of stem cells into the abdomen and using acupuncture, specifically electroacupuncture, to guide the stem cells to the eyes. Why? Because we know that stem cells migrate towards trauma, right? And alternating current stimulation and acupuncture can be perceived by the body as a microtrauma. Not that it's doing harm, it's just it's an alert system or a signal that's given off by the body to get the stem cells to the eyes for repair and regeneration. Okay, so we also know that it is facilitating a repair of the ocular vascular system, meaning we're helping improve the health and integrity and function of the blood vessels, right? Really important for macular degeneration, right? We said earlier that the wet macular degeneration occurs, or dry macular degeneration becomes wet macular degeneration because of poor blood flow, poor oxygenation of the macula in the retina. Now, if we dilate the blood vessels and we have healthy blood flow to the macula, guess what, guys? Body is not going to have to create these new blood vessels, and you're going to avoid the advanced situation of wet macular degeneration. And even if you have wet macular degeneration and you're going to help improve the blood flow inside the main veins, arteries, and capillaries and choroid to deliver more oxygen to the retina, the body is going to cease to need to grow these new blood vessels. So your vision is going to improve, and you're going to be at less risk for wet macular degeneration, and you're no longer going to need the injections because your body's just not going to need to grow these new blood vessels that are at high risk for breaking and causing hemorrhages. All right. If you have questions on that, type in the comments or reach out to me. I know that's can be pretty medical there. So that's really what we're talking about, guys. We're talking about improving oxygenation to the macula. We're also, when it comes to macular degeneration, another really, really important factor that alternating current stimulation does is it activates a part of a structure of the retina called the Bruch's membrane. Now, the Bruch's membrane, what that structure does is it helps the body, or specifically the eye, break down ocular waste. In this case, drusen, right? Drusen, that cholesterol, protein, calcium mix, that waste product, the Bruch's membrane has gotten weak with age, and it's not able to break down, digest, and eliminate the drusen. So with alternating current stimulation and acupuncture, we can activate and stimulate the Bruch's membrane into function to turn it over to start breaking down the drusen. And we've seen that in real time. I have patients who've done electroacupuncture and alternating current stimulation. We've actually done what's called an OCT, ocular coherence tomography, which is a structural cross section of the macula, and we can see fluid, blood, and drusen actually decrease. We actually have seen this. So if you're part of our AccuVision Acupuncture Facebook group, you see this. I post these results often when it comes in. So really, really interesting effects there that I wasn't aware of, right? That's why we do this research and we do testing, because we want a metric. We want to measure structural and functional improvements with your macular. And we certainly see that. We also know that it's safe and effective, right? Alternating current stimulation. Worst case scenario, guys, it's just not going to work. That's the worst case scenario. It will never cause any harm. It will never do any damage. The worst case scenario is we had some patients who they jacked up they first got the units and they turned up the stimulation to really high and they got a headache. And that was just going against our recommendations. The only condition that I'm concerned about, and I don't recommend people use alternating current stimulation, is people who have uncontrollable migraine headaches and people who have seizure disorders like epilepsy. That's a no-go with this treatment. But pretty much everybody else is pretty good to go. And the only other situation, or I guess negative side effect, if you will, that could happen that I'll talk to you about is some people with dry eyes, or if they had LASIK surgery, or even not so much cataract surgery, but definitely LASIK surgery and dry eyes, or corneal dystrophies. When you put the pads over your eyes, if there's a lot of pressure, maybe you have a larger circumference to your head, or you have, again, really dry eyes, and there's a lot of pressure of the pads on your corneas, they kind of take the convex shape and flatten it out. And when that shape flattens out, it can make your vision blurry temporarily. It will go back and return its shape, but most people will return in a minute or two, even up to 3 minutes. But people with really dry eyes or corneal issues, or those who've had LASIK surgery, it may take a little while, even sometimes up to an hour. So it's not an issue. It's never going to make anything worse. Don't worry about it. But if you're concerned, or that's something that's happening for you and you see the blurriness, we're just having patients, we're instructing them to either move the placements of the electrodes or use like a scarf or a handkerchief that's a little looser, put less pressure on the eyes. And that's an easy remedy to that. So the other cool thing I mentioned earlier about alternating current stimulation is it does stimulate all the vital acupuncture points around the eyes that have been used for over 4,000 years with empirical evidence to show it absolutely helps improve and preserve vision. So we know that there's millennia of empirical research around acupuncture's efficacy for these types of retinal diseases and macular degeneration. And it also, and with that, it's just going to help promote and accelerate the recovery and preservation of vision. So the reason that we again did research on this was, of course, we wanted to make sure that we had specifics on the metrics. And what we did in 2019 is I took a group of patients who had various retinal conditions and optic nerve conditions, a lot of which had macular degeneration. And we had them do some testing. Then they went home and used the ACS unit, ACS 3000, and came back, and we did testing with them. And we asked them, what have you noticed? And we did vision testing, things like acuity, OCT testing against ocular coherence tomography. We checked color vision. We did visual fields on them, near reading, distance reading, to see what improvements they had noticed. And 90% of our patients showed measurable improvement, and 70 to 80% of patients showed subjective improvements. So there was real improvements. It was more than I actually thought. I was just hoping to get 70, but when we saw the 9 out of 10, it was really, really inspirational. So as I mentioned earlier, it can be, ACS 3000 can be used as a standalone therapy if you can't get to clinic or you can't get to any other therapy. But in addition to using it as a standalone therapy, we do recommend you do other things to help your vision, because it's only going to accelerate your recovery. It's going to get you a better result. So we recommend you can integrate it with things like ophthalmic acupuncture. We definitely recommend you take supplements for your eyes. We have a macular degeneration starter pack, or if you have other things going on like Stargardts or pattern dystrophy or myopic degeneration or Stargardts or CSR, please feel free to reach out to me or go to our website. And we have specific recommendations for supplements based on those conditions at our website, eyehealthinstitute.com. So definitely recommend you take supplements. Why? Because we're dilating the blood vessels around the eyes again, and we want to get these vital nutrients to the eyes because they've been starving, right? Macular degeneration is suffocation, not enough oxygen, and starvation, not enough nutrition of the eyes, married up to poor cellular detoxification, where we have the accumulation of drusen. So we need to get the oxygen, we need to get the food, and we need to get detoxification. That's really what we're talking about. We use specific herbs and supplements, Chinese herbs, nutraceuticals, daily meditation, Ai Qigong we recommend, daily physical exercise, stress management, if that's something that you're dealing with, managing any other comorbidities. If you guys have had the opportunity to watch my videos on macular degeneration, you know that it's a cardiovascular disease. So 8 out of 10 of my patients, 7 to 8 out of 10 of my patients with macular degeneration have coexisting cardiovascular disease. They've either had heart issues, they have atrial fibs, they have hypertension, they have history of stroke. There's a family disposition or predisposition rather of cardiovascular disease. So it's there, guys. Cardiovascular disease and macular degeneration are two branches of the same tree. So anything that's heart healthy is going to be macular healthy, and anything that you do for your macular to help improve that function is going to, absolutely help with your cardiovascular health. So stress management, stay hydrated, improve your sleep habits, certain diet modifications are going to be really useful. And we're going to do a whole lecture series on diet and nutrition specifically for macular degeneration and retinal health. So you guys can look soon for that. So there is a lot, guys. I know, you go to your eye doctors, you got macular degeneration, maybe it's you, your loved one, your family. You're told that, hey, there's not much, take Arids, maybe take lutein, zeaxanthin. That's it. If you have wet macular degeneration, you can get your injections. And even if the bleeding stopped, they still keep bombarding you with the injections. They tell you got to keep coming for the shots. Maybe your doctor is recommending that, maybe they're not. But my point is that I want you guys to be clear that you don't get a false sense of security thinking that these injections, if you do have wet macular degeneration, that they're doing any good for your macula, because they're not. Again, all they're doing is they're trying to control the bleeding that's going on, but they're not doing much to really help with the underlying neurovascular issues, the macular detox issues, the oxygen deprivation, the lack of food and nourishment, and of course the antioxidant protection. So I highly recommend after watching this, if you guys, when you have the time and inclination, go to my YouTube page and watch my video on macular degeneration, because it's a little deeper dive. We talk more about that. You can watch my videos for sure on carotenoids. We did a lecture on cataracts as well, because a lot of people with macular degeneration have early cataracts. So carotenoid supplements really, really important. Watching, keeping your eyes protected from blue light, screens, phones, very, very important. So make sure. I don't want to get in too much to that now, but I have quite a few videos on that. So again, alternating current stimulation, super, super effective way to affordable, accessible home treatment. Use your supplements, diet, exercise, whatever you're doing. Add this to your therapy to help recover and preserve your vision. If you have any questions about alternating current stimulation, please feel free to reach out. If you want more specifics on your condition, please feel free to reach out. If you have a lot of questions, you might want to consider booking a telehealth consultation with me where we can do a 30 or 60-minute dive, find out more specifics about your condition so that I can figure out more about what I can do to help you and make specific recommendations to help you recover and preserve your vision long term. So thank you for joining me. I really appreciate you guys taking the time. I know there's a lot of other things you guys can be doing at this time. I hope you found this informative. If you have any questions about the alternating current stimulation or supplements, please feel free to reach out to me or my team. We are here for you to answer all of your questions. Take care, guys. We'll see you soon. Bye-bye.